All right, good afternoon, everybody. Thank you all for joining me. If you're able to hear me, please raise your hands. We've all learned to use Zoom in the last couple of years, and it's second nature now. Fantastic. I see hands going up, so we're going to power forward. My host is going to be sharing their screen. Here we go. Fantastic. Okay, so welcome to Full Circles Practice and Pregnancy Orientation. This is a little something special I do twice a month to make sure that we are all on the same page about what's going to be happening during your pregnancy. So congratulations, you're over here hanging with us. And so a couple of housekeeping items first. I want you to go grab your pencil, grab your paper, or your notebook or your digital notebook now because it's 2024. Sorry, y'all, I'm a 70s baby. Everything here is confidential, so feel free to ask me questions. No one will be able to see that you're asking questions, and I will answer them in such a way that people won't be able to figure out that it's you. If it's something that I think is too personal and we may be able to figure out who the person is, and I may say, let's hold this until your appointment. So please participate. I have lots of poll questions hidden throughout here to just kind of make sure you're still engaged and listening. And then if you have to hop out, I understand it's dinner time for some of you and other things going on, especially if you already have little ones in the house. Don't worry, this presentation will be available on our YouTube channel later on, and we usually keep them up for about 6 months, so you'll have the most current information available. So we're going to start with a poll question right now to show you how it works. Who's on the line? How many first-time mamas do I have, and how many veteran moms do I have? So also when you answer these questions, it's kind of like a choose your own adventure for me. Kind of lets me know whether or I should spend a little more time on certain topics because first-time moms may be curious, and whether or not I should move on to something else for veteran moms. I know we have a couple of partners and spouses, dads on the line. So welcome to you all as well. And we will end the poll, and it is split right down the middle. I have just as many first-time moms as I do veteran mommies. So that means I'm going to say everything that I meant to say before. So let's get started. We'll start with just a little overview on the full circle experience, which includes where we deliver. We'll go over some office protocols, pregnancy visits, what to expect at those. I'll give you lots of prenatal resources. We're going to talk about exercise and nutrition in pregnancy and fly through a quick COVID-19 update because, yes, that's still a thing. So we'll start by going over kind of the philosophy here at Full Circle. So we are a collaborative midwifery model practice, which is based on the principle that pregnancy is normal. Pregnancy and birth are normal, and they are life processes. They are not diseases that we have to cure you from catching. And so, to that end, this is a physiologic process, and our goal is just to observe and guide wherever necessary. In the traditional midwifery model, we care for normal, low-risk women, but if we identify certain abnormalities, you have to transfer out of midwife care into physician care for different acuity and attention to certain issues. In the collaborative model, you are able to stay in the care of the midwives with physician direction. So if something arises that would typically require physician consult, we are physician consults here at the practice every day, all the time. And so the midwives are able to consult with us to guide your care. However, because midwives are the experts in normal labor and delivery, the majority of our deliveries are attended by the certified nurse midwives. So I know some of you came in as my GYN patient, Dr. Marrow's GYN patient, Dr. Mooney's. You're like, oh, okay, I'll just transfer over and the doctors will just do my OB care. Not really, unless you develop an issue. And in that case, we actually meet twice a month and run the list and go over everyone, and if they have no issues or some issues, and we make a plan. So if you're hearing a plan about something that's going on with your pregnancy, it is the physician plan for you relayed through and carried out through the midwives. If in labor something happens that's outside of the scope of midwifery, they are to call us for urgent physician consults. And urgent means it's something that can't wait until morning, like your baby, whatever, you've reached a certain dilation, baby doesn't want to come out or it's misbehaving or whatever. All of us live about 15 minutes away from the hospital. An urgent physician consultation will have one of us there to handle whatever is going on. If it is an emergent consultation, meaning there's something that cannot even wait 15 minutes. Where we deliver, there is the OB hospitalist group. There's a board certified OBGYNs who are in-house 24 hours a day with the anesthesia team, and they are available to get you in the operating room in under 5 minutes. To put it in perspective, we do over 500 deliveries a year. And just looking at our numbers in 2022, we use the hospitalist twice. And the most common reason we use the hospitalist is actually not a bad emergency, but kind of like you come in, you're 10 centimeters and like nobody's there to deliver your baby. So please give us enough notice so we can get to the hospital to do it. So where do we deliver? That's a great question. We are at HCA, Florida Memorial Hospital, which is a 9-minute drive on the front streets. I go the back street, so it's 6 minutes for me from our office. They do tours. They have one-to-one tours available. So if you're not able to make it to any of their stork tours, when you're in for your regular prenatal visits, you'll see on the wall a schedule of stork tours, and those are really cute. They're baby showers kind of that they throw. They raffle off prizes like pack and plays and strollers and a lot of fun stuff. There's food, and you can tour the unit, meet some of the nurses and the nursing director. If you can't make it to any of those dates that are available, there is a phone number we can give you, and you can arrange one-to-one tours. They do them really almost any time of the day. They do them in the evenings. They do them on the weekends. They want you to see this beautiful new renovated unit and get to see the wonderful friendly staff there. So we want you to see where you're going to be meeting your little one or little ones at HCA Florida. I think some of you are veteran moms delivered with us when we were at Ascension, and we'll talk a little bit more about our move a little later on in the call. But it's been a great move for us. Office hours, we are open Monday through Thursday from 9 a.m. to 1 p.m. We then close from 1 to 2 for lunch, and then we reopen at 2 o'clock and we stay open until 5 p.m. On Fridays, we're open from 9 to 1. So if you call us during lunch from 1 to 2 p.m., it will roll over to our after hours voicemail. Don't let that freak you out. The reason it does that is because if you have a medical emergency between 1 and 2, the after hours voicemail connects to the person who's on call so that you can reach the person who's in the hospital. However, it does not roll to anybody who's here in the office. So if you need to talk about something administrative, like you're going to be late for your 2:30 appointment or something like that, please don't leave that voicemail on the rollover. And also, we know that the phones are down. They're not broken during lunch. They're just rolled to the on-call provider. But if there is something that's urgent during the lunch hour of a clinical nature, please leave that voicemail so that the on-call person can reach you. If you're calling about administrative matters on a Friday at 12:54 p.m., please know that call may be responded to on our next business day, which is Monday when we open up at 9 a.m. For appointments, we don't have walk-in appointments because our goal is to see you as close to your appointment time as possible. And if we promised you the 12:20 spot, we can't see you at that time if someone else decides at 12:17 she's going to walk through the door and take your spot. So we try to respect the time that we promised you. We ask that you do the same thing for your fellow patients. To that end, there are limited same-day appointments. Sometimes people deliver and appointment slots clear up. So if you call in the morning and say, hey, I really think I need to be seen today for this, we will check the schedule and see if there is an available slot or put you on a side list that if something clears up, we may call you to bring you in. But if there isn't anything clearing up and we agree, hey, you actually do need to be seen for this, they may recommend that you either go to the hospital to be seen in the triage area or to an urgent care. And that's not us saying that we don't want to see you here in the office. That's us agreeing with you saying that you do need to be seen and not just sitting in our lobby for 3 hours waiting to get worked in. If you are calling the office, the providers are not able to leave patient appointments to take phone calls because, again, we promised that time to someone else. So if you have a 10:20 appointment with me, it's not fair for me to get up at 10:25 when you're in the middle of your sentence because someone else calls in the middle and they have a question. We do have a triage nurse who is able to answer many of your clinical questions. A lot of the same questions come up in pregnancy over and over again, and she's able to triage those and give you the best answer that she can. If there's something that's outside of her scope, she then knows how to escalate it and speak to the on-call provider to get you a better answer. So if she calls back and says, I don't have an answer, but let me get it for you, just give her some time to reach out to that person and get back to you. When you're calling the office, you have to leave a message to get a call back. please be sure you're leaving the message in the right place. Please don't leave a message about your mucus plug with our biller. One, it freaks him out. Two, he can't do anything about it. Three, we may never get the message about your mucus plug because the biller would obviously check the messages at different intervals than the front desk or our clinical staff. So please be sure you're listening to the prompts and leaving your message in the right place so we can call you back and address whatever your concerns are. So who do you call? Great question. Tony is our clinical operations manager, and she handles things like letters. If you need to suspend your gym membership, you don't usually need to suspend your gym membership. We'll talk about that later. If you have FMLA forms, if you have short-term disability that needs to be filled out, Tony's your girl. Naisha is my OB clinical coordinator, and many of you have already had some interaction with her. She is the one who emails your prenatal labs to you and or arranges where you're going to get those done. She also manages all of our referrals. So if you need to see a cardiologist, a high-risk OB doctor, a hematologist, or if at the end of pregnancy you need something scheduled, like an anesthesia consult, induction, what have you, and she schedules circumcisions. So she'll be the one to reach out to for any of those matters. Everyone on this call, I believe, has already met with Renee Hall, who's our benefits coordinator. So if anything changes about your insurance, if you happen to, someone else in the family has something going on and you meet your deductible and you say, hey, I don't think I really still have to pay this prepayment plan, please reach out to Renee Hall and let her know if something has changed. If your job changes insurances, those sort of things, please keep us up to date because it's not our goal to unnecessarily collect on things that no longer require it. Our goal is just to try to mitigate the money going in, the money coming out. After hours, there is someone from our practice on call for our practice at all times. This is the emergency on-call provider. So remember, this is the person who is also physically in the hospital, catching babies, managing labors, and that sort of thing. So please only call her if you feel like you need to join her. If you think you need to go to the hospital, then give us a call at our regular office number, follow the after hours prompts to reach the on-call provider, and you have to leave a voicemail. If you don't leave a voicemail, it does not register that someone called and hung up. You would be surprised how many times people pocket dial their gynecologist. And so we don't just go through and call back everyone who hung up. You have to leave a message in order for us to give you a call back. The other way to contact us is the patient portal. Please remember, the patient portal response times can take up to 2 business days. So as soon as you hit send on that message, a little message flies up that says, remember, this can take up to 2 business days or 48 hours, it says, I think, for response. But I'm telling you, if you send it on a Friday and 48 hours is Sunday, just know it's 2 business days. So things that you want to send us over the portal need to be able to wait 2 business days. I think the next slide, you guys can already see it. And so if it is a non-action item, it'll be answered at your next appointment. So if you're just asking about taking a vitamin or something like that, something that's not urgent or doesn't urgently need to be answered before we're going to see you in the office in the next couple of days, then we may just pass that to the next person who's going to have an appointment with you, and she'll be able to answer that for you as well. So the portal is best used for things like, I lost my lab slip. I was just in the office, you printed out this lab slip. I want to make sure I have it with me just in case Quest doesn't see it in their computer. Can someone email me that? Because you want to get those labs done before you come back and see us again. So that's something that can't wait until your next visit. Or if you need to cancel or reschedule your appointment, you can also send messages through appointment request to the front desk. And if it's more than 2 business days away, they'll have time to either convert your visit to a telehealth visit so we can still see you and check on you, or reschedule it for a couple of days later when you're feeling better. Things you don't want to do on the portal. Please don't send urgent matters. So when people send messages that I see 2 business days later that say, my blood pressure is really high, I have a terrible headache, I can't see out of my right eye, please don't put that on the patient portal because that can't wait 2 business days. That is an emergency. If you're not feeling your baby move, if you're having heavy bleeding, those are not matters for the portal. Those are things that you need to call and speak with the on-call provider. Remember, there's always somebody on call for our practice 24 hours a day. So for those matters, please do not use the patient portal. Those things make my blood run cold. Other things you don't want to do with the patient portal. Blitz messaging. So if you sent one message, remember that person has 2 business days to respond. So if you don't wait 2 hours and then send the same message to someone else, and then 2 hours and wait, send the same message to someone else. We've had people be very upset because they call, oh, I think I have a UTI. They get to the pharmacy and they have 5 prescriptions waiting for them. And they want to know, which one am I supposed to take? Why would you send all these medicines? Well, you contacted 5 people. And so 5 people were working on your problem, and 4 of them were not working on someone else's problem. So please let us efficiently spread our ability to work on everybody's problem by only sending a message to one person. If you send the message and you realize, I actually cannot wait for a response, maybe this is an emergency. And maybe you should not use the portal, but reach out to us via telephone. Also, don't send the same message to different people or multiple messages to the same person. Try to reply and keep everything in the same thread, because when you send a new message, if someone's on vacation, they're looking back and trying to figure out what you and that last person have been talking about. So keeping one thread open is also super helpful for us to just follow the chain of messages. I get about 20 to 30 messages daily, and I can't always remember that you and I were specifically talking about a yeast infection versus the other 10 people who have one at the same time, especially around Christmas, because all the sweets y'all are eating, everybody has a yeast infection at Christmas. Also, please do not attempt to have an appointment over the portal. Please don't attach multiple articles that you want to discuss and all of these different things, because the portal is really what we do in our spare time after we've seen patients all day, reviewed labs, and finished all of our charting. The portal is for things that we can do to make your life a little bit easier. But really, if there's nothing there, we'll be spending this time with our family. So we'd love to spend that time with our family. If they're just questions that can wait until your next visit, start a text thread with yourself. Or schedule an appointment. We have lots of appointments, and we're happy to go through whatever articles or questions you have in depth at an actual appointment in the office. Other things that we use the patient portal for include ultrasounds. Now, when you have your ultrasound, if there is something urgently abnormal on it, like you need to have a plan and a referral on that same day, we will not let you leave the building without talking about it. Otherwise, we download the reports. It's just as if we sent you to an outside facility to have an ultrasound done. But we do it here because a lot of times insurance companies will contract for less with us than they do for facilities, and it ends up saving you a lot of money. But we have to download the report. It has to be uploaded into our electronic medical record system and then distributed to providers for review. So please give us 2 business days to receive the report, review it, and respond with our commentary. If you know that your anxiety is not going to let you wait 2 business days to find out what's on that ultrasound report, I recommend that you schedule a prenatal visit in the office on the same day as your ultrasound. That way, the provider can get a preliminary printout from the sonographer and she can talk to you about it in real time on that day. So you won't have to wait. I know sometimes you'll see them in there typing away, and you think, oh my goodness, what is she typing? You go to your car and send a portal message, what's on my ultrasound report? And my answer is always the same. I'm not sure because I don't have the report yet, but I know it is not urgently abnormal because we let you walk out of the building. So that is the take-home message there. And I have a couple of questions up here that are about food. So I'm going to get to food a little bit later on. So cut and paste and save this for a moment. And we're going to get to nutrition in a bit, but I won't skip ahead to that. We're going to go ahead and get through just this stuff right now. All right, guess who else has a portal? Quest. But sometimes they send the labs to you and not me, and I ordered them. Doesn't that seem weird to you? But they do. They send them to you, and you see them, and you see these red marks on there, and it freaks you out. Just remember, deep breath. Red doesn't necessarily mean abnormal. The reference ranges that they're using to say what's normal and what's not are for non-pregnant people. When you are pregnant, there are some physiologic changes that make certain numbers normal outside of the range of what you normally see when you're not pregnant. So again, give us a chance to receive the labs from Quest, review them, and release them to the portal. Now, if you've had them on your Quest portal for over a week and you haven't heard anything from us, please then do reach out to the person who ordered them, like the midwife who ordered them at the visit, because then we can reach out to Quest and say, hey, we want the copy of them too. But don't send us the results of them. And sometimes I'll get messages that say, hey, I just got my thyroid levels back. I want to go over this. I want to go over that. What that's like is where we're sitting there doing our report and trying to review labs, and somebody's going like this, hey, look at this, look at this. So if you will just give us a chance to get the results from Quest, because when we get them, we're going to review them again. And again, our goal is just not to do things 2 or 3 times. So give us a chance to receive them, review them, and release them to you with our commentary. All right. Any questions about communicating with us via the portal or what things go in the portal? Okay, cool. Very good. We're going to move on. Let's talk about prenatal visits. Remember I said text yourself questions? All right. What I can guarantee is that you are going to get pregnancy amnesia. Pregnancy brain is real, y'all. You will walk into a room and stand there for 5 minutes because you can't remember why you went in there. And that happens even more during your prenatal visits. So text yourself a thread of questions to have with you, because we're gonna come in, we're gonna do the heartbeat, the blood pressure, and all these other things. Once you hear that heartbeat, all of your questions just fly out of your head, and we're like, all right, what do you want to talk about? And you're like, I don't know. So bring out the phone and let us know so we can answer your questions. It's your time to chat. Please wear loose, comfortable clothing so that we can access your belly. Rompers are a terrible choice for prenatal visits. Long dresses without shorts underneath are also not a great choice, because we want to get to that belly. We need to listen to your baby's heartbeat at every visit. We're not doing an ultrasound at every visit, but we are pulling out that Doppler because we want to hear that little one's heartbeat every single time. So we ask that you come in about 5 minutes before your scheduled appointment time, so you'll have time to check in with the front desk, handle any insurance issues, and then if you have to go to the restroom, you'll have time to do that as well. We are not routinely collecting urine before prenatal visits anymore. Some of my veteran moms remember when we used to do that at every single visit. Well, the American College of OBGYN now says we don't have to do that anymore, only if it's indicated. And you'll know if you need one because you were recently treated for urinary tract infection, or were following your urine for a protein for high blood pressure, or sugar for gestational diabetes, or that sort of thing. Otherwise, we know you've been drinking your water because it's summertime and you're pregnant and you better be drinking your water. And you've just driven for a while and you need to run in and go to the bathroom really quickly. So go ahead and do that, and you get here ahead of time. Other things, I think you guys can see the next screen. If you are 10 minutes late, we'll still have time to check on you and your baby, but obviously that leaves a little less time for your questions. If you're 20 minutes late, oh no, you missed your entire appointment slot. As I said, front desk is really good about monitoring the slots. If they know someone is canceling from a slot maybe 20 or 30 minutes later on, as you're walking in 20 minutes late, they may say, hey, you just missed that appointment, but another one is open in about 20 minutes. Can you wait for it? If you can, fantastic. We'll work you in later in the day. If you're not able to wait for that, like you have someplace else to be, then they're happy to get you rescheduled to a time that works better for all parties involved. All right. Diagnostic ultrasound. So the next question I always get is, when is my next ultrasound? Another great question. You guys have great questions today. So diagnostic ultrasounds are different from regular prenatal visits. The way to know if you have one scheduled coming up is to look at your portal and see, do you have more than one appointment time? And is there a provider's name associated with your visit? So Tina Test is my practice patient. She's not a real person, but when Tina logs on to her imaginary portal, she clicks on the appointment tab and she sees that she has 2 appointments coming up. So one of her appointments is at 9:20 and it is with ultrasound. That means Tina has an ultrasound scheduled. After that, she has another appointment with Dr. Yeckel because maybe Tina cannot wait 2 business days to get her results. And so Tina can tell her family, hey, you guys want to come with me and see the baby? Come be with me at this 9:20 appointment. And then afterward, you guys can stay and hang and listen to Dr. Yeckel talk, or you can take off. And so that will kind of help you plan as well. Now, if you know you're supposed to have an appointment scheduled, but you do not see it in the portal, please reach out to us if you don't see that there is an ultrasound visit scheduled for you as well. But this is how you know when your diagnostic ultrasound is scheduled. The results, remember, are then sent to your portal within 2 business days unless there is something urgently abnormal. In that case, we will break our usual schedule and one of us will put you in a room and one of us will come in between our patients and talk to you about what was found on the ultrasound because our sonographers have been doing these ultrasounds with high-risk patients for many, many years and they know what things should walk out of the door and what things shouldn't. If you're finishing up a prenatal visit with one of the providers here and they say, all right, it's time for your next ultrasound, please be sure when you go to the front desk that you are scheduling 2 appointment times so that you have a regular prenatal visit as well as an appointment. Again, maybe not even on the same day, but just be sure that both of those things are getting scheduled so that you're not coming back the next day saying, I thought I was getting an ultrasound today, because there are multiple ways to know whether you're getting an ultrasound on that day. All right. If you would like to look at your baby more than we need to look at your baby, there are boutique ultrasounds all over the city. These are just a couple for informational purposes, not saying any one is better than the other or endorsing anyone over the other, but I tried to put a couple in different areas of town. I know there's one in St. Augustine too, and I can never remember the name of it. But these places you can do ultrasounds, which are perfectly safe because they are just sound wave. There's no radiation to them. But they will do really cute things like put the baby's heartbeat in a stuffed animal and give you all these 3D pictures. And for those of you who are not planning to do any genetic screening that could tell you the baby's sex, a lot of these places do sneak peek ultrasounds at 13, 14 weeks, maybe 14, 15 weeks, that can tell you whether you're having a boy or a girl or boys or girls. Got twins going on. Question I have out here, are too many ultrasounds harmful to the baby? No, absolutely not. Again, they are just sound waves. Your baby is exposed to sound waves all the time, unless you live in a bubble or a vacuum. All right, so we are asking this poll question here before we head over to the website. When can you expect an ultrasound? Routine ultrasounds, actually, because routine is the key here. All right, we have somebody answering the questions. More answers, more answers, more answers. And the poll are closing in 4, 3, 2, 1, closed. All right, the answer is at 20 and 40 weeks. That is correct. So your routine anatomy ultrasound is at 20 weeks. If you have some other issue going on with the pregnancy, like some risk for short cervix, we may look prior to 20 weeks. And if at the 20-week ultrasound, we don't see everything we need to see, we may look again after 20 weeks. But if everything is straightforward and normal with the pregnancy, we look at 20 weeks, and then you don't need another one unless you have new developing diagnoses until after your due date. All right. Here we are on our website. This is fullcirclejax.com. And as I mentioned, for the veteran mommies who delivered with us at Ascension, we moved to HCA Florida in October of last year. And if you have questions about why would we do that? You can click here on the banner to watch the town hall that I held in October to explain some of the reasons why. And just let me assure you, we are at over 200 births there now, and it has been an excellent move. Everybody is very happy with HCA Florida. All right, so we're going to start with the providers here. So also, well, for my new mamas for sure, but for my veteran mamas, we may have had some lineup changes since you were last here. So our providers are, here's me with more hair. There's Dr. Miro with about the same amount of hair. There's Dr. Yeckel, and there's Dr. Mooney. And then we have the midwives. There's midwife Lauren, midwife Krista, midwife Cindy, midwife Dawn, midwife Missy, and midwife Jane. And each one of us, I promise you, this is our absolute favorite thing to do. And so we don't know which one of these lovely ladies will be on call when you go into labor. So we recommend that you meet as many of the midwives as possible. Everyone has their OB history visit with me unless you're a transfer inpatient. Some of the transfers meet either Dr. Miro or Dr. Mooney, but the idea is that you will not see me again. You're going to be hanging out with the midwives for delivery. All right, next we're going to head over to the patient information slot, and you're going to hit the obstetrics tab, and you'll know you're in the right place because you will see all these developing bellies, which end in a really cute baby there at the end. So on the left, you'll see our delivery statistics. And we're very proud of our statistics. We're also very transparent because many of you are here because of our statistics. You are trying to avoid an unnecessary cesarean for the first time or a repeat. And you can see our statistics all the way back to 2018 are listed there. We're going to click on the next box, the prenatal care timeline. So next we'll be going through what to expect at each visit. So everyone on this call has already had their pregnancy confirmation visit where you met with Taylor, my confirmation sonographer, and one of the midwives. We set your due date and they gave you some information about the options for genetic screening. You watched a video with this face giving you some information about where to text to get more information about genetic screening, and you have a history visit either behind you or coming up very shortly with me. At the history visit, I will be I'll be ordering some routine prenatal labs. So we're also transparent about what labs are being ordered. We want you to know what is getting checked for you. So the labs that you have on here are the American College of Obstetrician. These are the standard labs that are recommended. You also met with Renee and discussed any insurance things, and your homework after you meet with me is to try to set the appointment at Quest or LabCorp or First Coast Testing Services to get your blood work done. Probably about 50% of you will opt in for the next box, the optional genetic screening, which includes the non-invasive prenatal testing, or the nuchal translucency ultrasound, which is done around 12 to 13 weeks. So at this point in pregnancy, we're seeing you every 4 weeks. So roughly 4 weeks after you had your confirmation ultrasound, you'll also be scheduled for a physical exam. I know when you called in for your confirmation and they said, let's schedule 3 appointments, you're like, whoa, I just met you. But these are the 3 appointments that we like to have all scheduled so that you can plan out things very well. Your OB physical exam is just like it sounds. It's a physical exam. Only difference is you're pregnant. So we'll be listening to your heart. We'll listen to your lungs. We'll do a pelvic exam. If you are due for a PAP, you're welcome to get that done at the same time, but that's not really part of the prenatal panel, so we don't have to do a PAP test exactly at that time. We do need cervical cultures, so if you're not comfortable with a speculum exam during pregnancy, you can always do a self swab, but the cultures we need as part of the ACOG panel. If you have a high risk issue and need to be referred to MFM, this is usually around the time when they start seeing you in conjunction with us. About 4 weeks later, you come back in and we have your second trimester visit where we talk about normal second trimester changes around ligament pain, starting to feel the baby move, which is very exciting. And there is some optional testing regarding baby spine as well. 20 weeks, as I mentioned before, is when we do the anatomy ultrasound, and you'll see there in the middle the mental health screen. So that is dependent on your history. We screen everyone with the EPDS for depression because pregnancy is full of emotions. It can be quite a roller coaster. And if you have a history of anxiety, we may also add in the GAD-7 for you as well to just kind of get a baseline of where you are and make sure that nothing emotionally is falling through the cracks as we progress in the pregnancy. If you're meeting with the midwife on that day, she'll go over the preliminary results from the ultrasound and possibly talk about childbirth education classes and or breastfeeding classes. 24 to 28 weeks, so about 4 weeks after your anatomy ultrasound, is when we'll see you for the glucose test. I know we have lots of questions about that, so we're going to put a little pin in that and come back to it later. And along with the glucose test, we recheck your blood count. And for moms who have a Rh negative blood type, we make sure that we have a plan about RhoGAM administration, which is usually given about 28 to 30 weeks. If you're planning on working with a doula, and we're going to talk about who doulas are and why they're important, you want to start selecting her, schedule your hospital tour if you haven't done one of the stork tours, and HCA registration at the hospital, everything is online. So you want to create your portal account. I know, another portal. You want to create your account with HCA and put all your information in to try to minimize the stuff you have to do between contractions when you go in labor. After these visits, you're going to start seeing us every 2 weeks. We start getting really cozy. You'll see there in the middle, you have the option to repeat or decline the prenatal labs. So this is not ACOG necessarily, it's more Duval County Health Department. There are different risk stratifications in the county, and certain populations are at higher risk for contracting STDs during pregnancy. If you feel you are not in that high risk group, we do have a form that's very easy. You can just sign and decline. You'll see over there on the right column, if you're opting in to get your Tdap vaccination, your tetanus booster, to get your flu shots. I don't think this is the flu crew, but these things are available at certain times of the year, and or RSV. For my first-time moms, you want to select your pediatrician. For my veteran moms, you want to make sure that you're staying with your same pediatrician and just kind of update us on who it is. Most of the pediatricians do not come to the hospital. So we want to make sure that we know where to send your baby's records when he, she, or they are born. And we continue with the every 2-week visits until about 36 weeks. If you have other pregnancy complications, you may have additional testing that starts at 32 or 36 weeks. My moms who are planning a belly birth, which is our word for the C-section, will start to get that date on the calendar for you when you're around 32 to 33 weeks so that we can reserve that for you and you can start planning what you need to. At the 36-week mark, we do another pelvic exam and we screen for group beta strep, and we'll explain what that is and why it's important at that time. If you've already opted out of repeating the STD testing, that goes for the repeat cultures at 36 weeks as well. After this visit, we start seeing you every week. We're in the home stretch. So your birth preferences, which we're going to talk about in a moment, you can bring those in because after 36 weeks, you are full term and anything on that birth plan is up for grabs. You're going to start your natural cervical ripening methods. My belly birth mamas are going to get off the train around 39 weeks. And my moms who are waiting for babies to give the signal for labor are going to be patient, be very, very patient. And we like everybody out by 42 weeks. So for first-time moms, 41 weeks and 5 days is where we'll typically schedule your induction if needed. For my veteran mommies, 41 weeks and 6 days, just so everyone can typically be out. As we head back to the website, it's a nice time to remind you, for first-time moms, the average length of labor is 24 hours. So 24 hours of spontaneous labor. If we're doing an induction, we could be looking at 36 to 48 hours. And so that's why we start a little bit earlier. All right, I have a poll question. If you have a headache during pregnancy, are you more likely to medicate? Are you more likely to meditate? Are you more likely to evacuate your house and go to the ER? I certainly hope your headache is not that bad. Polls are closing in 5, 4, 3, 2, 1. All right, today we have more meditators than medicators. Zero judgment. It really depends on the day for me and depends on what's causing my headache. Is it my work? Is it my kids? Is it my husband? It's never my husband. All right. Here we have a common list. We have a list of common pregnancy discomforts. I have them in alphabetical order there on the left-hand side. In the middle, you'll see relief measures. So relief measures, if you send us a message and say, I'm having some back pain, the first thing we're going to say is, have you tried everything on the list on the website? And if you have, now some of y'all are getting really smart. I'm getting portal messages that say, hey, Dr. Adams, I have heartburn. I've tried everything that's on the website already. So you're like, don't at me. Okay. All right. Yes. So if you tried everything on here, it's all of these things, we have the relief measures. Those are things that aren't medicine. And over in the medication area, not everything is Western medicine. We have things like aloe tablets. We have peppermint oil. We have alfalfa for swelling. But if you've tried everything over here and you're still having the problem, then it may be time for us to either evaluate you here in the office, because maybe it's not what we thought it was, or move to prescription medications. So this continues on to the next page, and there's all sorts of things about cough and cold and all that other stuff, along with some things that we don't recommend and some caveats. If you've got nausea, vomiting, and if you can't keep down fluids for 24 hours, definitely give us a call. Don't keep trying things on this list. Things to stay away from, like Pepto-Bismol and aspirin and nonsteroidal anti-inflammatories. So if you're old school like me, just print out this list and stick it on the fridge, because I promise the time that you need it is always 3 o'clock in the morning. Or you can download it to your phone. But just know all this information is out there and available for you. All right, next on the list. There we go. You'll see the gestational diabetes screen there. Again, I said we were going to come back to it, and we are, but not right now. So just remember that this box is out there, and we're going to talk about the things that are behind it, but we're not going to click on it right now. The next one we'll click on is the weight gain in pregnancy. So many of you are concerned already about the amount of weight that you gained. Some of you are concerned because you haven't gained any weight. Oh, just wait. You will. So really for your recommended weight gain, it really depends on where you're starting. So there's a link here you can click on and put in your pre-pregnancy height and weight, and that will give you your pre-pregnancy body mass index. And according to that, it tells you how much weight you should be gaining to support a healthy pregnancy. For those who have twins, you can add 10 pounds onto the upper number there. But if you look on that last column, it says the rates of weight gain are in your second and third trimester per week. So in the first trimester, everyone's nauseous, like no one has an appetite. You don't feel like eating anything. You might even lose a little weight because you're barely eating anything. Don't sweat it. Again, your rates of weight gain are typically measured in your second and third trimester. So in your first trimester, you're not really doing very much in terms of the baby's weight and or increasing your blood volume and those things that add weight to us. So don't sweat it. The weight will come. Next, we have birth preferences. We're going to click on that one as well. So those who are interested in making a birth plan. So we like to call them birth preferences because babies have plans, and my veteran mamas know that yes, baby, you can plan all you want, but your baby's going to do what your baby's going to do. And so if your baby is in agreement with what your plan is, then your preference would be to have things go this way. And there's lots of stuff on here. So for my first time moms, you've never done this before, and it can be an anxiety provoking experience. And so sometimes writing things down and talking through different scenarios of what might happen help to decrease your anxiety and improve your expectations and your experience. So everything from how you'd like your labor to start to what you want to wear in labor, like if hospital gowns freak you out, there's no law saying you have to wear hospital gowns. We have wireless monitoring to encourage movement during labor. Obviously, there are pain relief measures where it's a hospital, so they have epidurals, they have IV pain medicine, but there's also hydrotherapy, which is very warm tubs that we can fill up for you to use for labor. And there's nitrous. The nitrous is now in the building, and there is a policy for it. And so the nitrous should be on the floor soon. Definitely by the time everyone on this call delivers, we will be doing nitrous. So I think some of the main take home points are that we're not strapping you to the bed or starving you. Like if you are normal, like you're not bleeding, your blood pressures are normal, we encourage movement in labor and we encourage sustenance in labor because this is hard work, and starving people before they push out a baby just seems counterintuitive. You can labor in any position, you can push in any position, you can deliver in any position. Our standard is perineal massage and warm compresses, delayed cord clamping, immediate skin to skin, early latch for breastfeeding, all of those things. So you can write those things down because they help you feel good, but just know those are the things that feel like you pretty much have to tell us if you don't want to do those things. There are also some other things on here, like what you plan to do with your placenta. There's a list of the routine medications offered to newborns after delivery. You always have the opportunity to come in and talk to the midwife. Hey, what is this medication? Does this apply to me? Do I need to do this? Is this something I can delay? If you have a little guy, you're planning to get him circumcised. If you have questions about the circumcision, you want to talk to one of the physicians ahead of time, because on the day of the procedure, our belief is that you know what you're getting and you're coming in and you're just there to have the procedure done. But I've done a couple of consultations recently with some mamas who were just had some questions about medical necessity and benefits and risks and all that of circumcision. For my twin mamas, you can still have your partner and your doula present, skin to skin between deliveries. And my belly birth moms, we do gentle cesareans here, which are family-centered cesareans. And so we just want everyone to know that even if you don't have a vaginal delivery, it's not, I have a vaginal delivery, so I get everything I want. I have a C-section, I get nothing I want. We have some really beautiful healing belly births as well. So just know that all this is out here too. It may seem daunting too. And the question I have here is, do you all accommodate birthing preferences? If you mean what's on this paper, yes, this is our form. So we accommodate things that are on this form. If you have something that's outside of what's on this form, bring it in, and we'll talk about it. Some things are harder to accommodate. Like if you insist everyone only wears purple and speaks Russian, it may be hard to find a team that can do all of that. But I think most reasonable things we're very able to accommodate. So just know that these things are out there. One box per week. Most of you have at least 20 weeks left in your pregnancy, and that's a good way to be able to break it down and address everything. Cervical ripening techniques that I mentioned in the what to do per week. After your 36 weeks, there are a lot of things here because everybody wants to know how to get this baby out. And everything on here, there's some things that you can start raspberry leaf tea at 20 weeks, but then beyond that, you want to wait until you're closer to term because while these things aren't meant to put you into labor, they can start to tone your uterus, make your Braxton Hicks a little stronger than they need to be, and soften your cervix before that's necessary also. And so you can just see week by week the things that we recommend, and you will notice one glaring omission on here is castor oil because we don't recommend it. And you should ask one of the midwives why we don't recommend castor oil later on. Some of my veteran mommies who got desperate may actually already know the answer to that question. All right, first time mamas, listen up. Also want to know, do we have anybody on the line who has had a cesarean before and is going for a vaginal delivery? If so, this poll question is for you. There are only two options here. Have you had a C-section before, and are you going for a vaginal birth after cesarean? If so, yes, you're going to rock it. Or this does not apply to me. And the polls are closed in 3, 2, 1. All right. Okay. Well, we have quite a few VBAC. I think that's like almost all of the veteran moms on here are going for a VBAC. Okay, so then this is for everybody. Um, First time moms in trial of labor after cesarean, you guys have the same goal right now. You are trying to avoid a cesarean that you can avoid. You cannot control what that baby does. I cannot stress that enough. But control what you can. These are ways, tried and true ways, to reduce conversion to cesarean. I say this as a VBAC provider. I say this as a VBAC mama. Dr. Merrill delivered 2 VBACs for me, and she's a VBAC mama too. And I delivered her VBAC, and midwife Lauren is a VBAC mama too. So you have lots of support here in the practice because we have walked in your shoes and sat where you sit. And we did all of these things on here because at the end of the day, you will be able to say to yourself, I feel good about my contribution to trying to make it happen. So you can read week or actually line by line what's on here. And moms, my first time moms, the most common reason that we have been doing C-sections recently is not baby's too big or baby's in distress. It has been baby is malpositioned. And that means baby's face head down, but the face is facing your belly. So sunny side up. And babies are supposed to be face down in order to come out easily, or crooked head. And a lot of that has to do with positioning and exercising that we're going to talk about in a little bit. So please, 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 please read this document. First time mamas, if you don't read anything else, please help me keep my primary cesarean numbers down by following the things that are on here. And I think most importantly here at the end is trust your body and trust us. Our goal is not to lead you down a path that is going to end up increasing our C-section rate. We don't want that. We want to keep you safe, but we also want to make sure that you're getting the birth that you came to full circle to get. Question I have here. As an older 40-year-old first-time mom, is it still possible to have a vaginal birth? Absolutely. Absolutely. We've had people transfer into us at 45 plus because their practice told them that they were too old to deliver vaginally. And what do you know? They had a beautiful vaginal delivery. So it is normal to be 40. If there are other factors that are going on, those things have to be considered, but 40 alone is not an indication that you will not have a vaginal delivery. All right. Last thing, if you have a little guy and you want to get his pencil sharpened, I'm sorry, and you want him to have a circumcision, we do those here in the office after you take them home. We don't do them in the hospital because they were just born. They don't even know how to be babies yet. So we give them a little bit of time to know how to self-soothe a bit, and then you bring them in. So just let us know at delivery whether you plan to have a circumcision for him, and our OB coordinator, Naisha, will reach out to you via the portal within about a day with his little appointment time, and you can bring him in and we will take excellent care of your little guy. And the question I have up here is, do you have some tips to avoid episiotomies? Yes, you should definitely deliver with a practice that does not usually cut episiotomies, like full circle. So there's that. All right. And my host is being funny. They changed my name to VBAC at 40. Oh, you tell everybody I'm older now. Okay, thank you. All right, we're moving into nutrition because I now already feel attacked. And then you show my favorite drink and that it has 570 calories. All right, for those of you who are worried about weight gain and you're saying, Dr. Adams, I don't know what I'm doing. I get up in the morning, I have coffee, I have fruit and toast, whatever. Do you have coffee or do you have this mocha monstrosity here, which is so delicious, but so many calories? Did you know pregnancy only requires 300 additional calories per day? That's it. Baby's like this big, doesn't need that many calories. It takes 10 kilocalories to maintain a pound, and your goal caloric intake is based on your starting body mass index. So let's say you start the pregnancy at 170. It takes 1,700 calories to net calories to maintain that. If you're supposed to be gaining 25 pounds in this pregnancy, that's 250 additional calories for a total daily caloric intake of 1950. We divide that between breakfast, lunch, and dinner. That's 650 calories per meal for a net of 1950. That's if you do nothing else. So if you're exercising and burning off some calories, you get to take in a few more calories. But then you can't wash it down with 570 calories of juice because your baby doesn't know the difference. They're going to take the calories that they need and leave the rest for you. Happy Mother's Day. So this is it's a busy slide, but it's got lots of good info. And remember, this is going to be on our YouTube channel. You can come back out to just remind yourself you want your carbohydrates to be no more than 40% of your daily caloric intake. You want to keep your sodium low. There are simple choices that you can make at the grocery store to keep the sodium down, to keep that swelling from happening. You want to take in as much fiber as you possibly can because that helps to keep things moving along, and limit your fats as well, and take your vitamins. All right, so what things is it okay for you to eat? You want to eat your fruits and your veggies and your whole grain and your cereal. You are not going to give your baby a nut or dairy allergy or sensitivity by eating those things, so enjoy. For my coffee drinkers, you want to keep your caffeine at less than 200 milligrams per day, but do remember that caffeine is a stimulant and can cause some irregular heartbeat in the baby toward the end of pregnancy. So if you are at some point able to wean down, please do, because 200 milligrams is still a lot. That's like 4 or 5 cups of coffee, which, like, to me, I would be bouncing off the walls if I had that much. Other things it's okay for you to have, I think the next, herbal teas. Yes. Raspberry leaf, we already talked about because it helps to tone the uterus. Ginger, lemon, and peppermint are some of our other favorites as well. For my bodybuilders, my weightlifters, or my vegetarians. So you want to make sure you have a protein source that's giving you 70 grams of protein daily. And whatever your usual protein source is, that's fine. Deli meats are fine as well, as long as you're microwaving them for 30 seconds to kill any of the bacteria in your cold cuts. They don't have to be steaming hot when you eat them. Just make sure at some point they were microwaved for 30 seconds. For soft cheeses, if it's made with pasteurized milk, you're fine. If you're buying it at Trader Joe's, just flip it over. If it says pasteurized milk, you're okay. If it doesn't say, don't eat it. If you're out at a restaurant and you can't tell if it was made with pasteurized milk, I mean, most restaurants aren't taking that risk, but if you can't verify, then just skip the brief for the evening. Canned tuna, you can have 3 of those 4-ounce cans per week. If you are a pescatarian and you need to have more fish or fish choices, the FDA has a really nice document at this website address that you can see here on the screen, telling you which fish you should eat in larger amounts because they're higher in omega-3 acids, which are good for baby's brain development, which ones you should eat in moderation, and which ones you should eat sparingly or avoid altogether, usually because of things like methylmercury. And this changes, that this document is fluid, so I just always leave this out here. I think, obviously, I made this presentation in 2021, but it's updated with what fish you should and should not be eating. Things you want to avoid: undercooked meats and fish. So yummy ahi tuna, medium rare steaks, which are clearly the best. Sorry. You must ruin your steak for the next 6 months and make it medium well. Enjoy that. For my kombucha drinkers, my kimchi eaters, those are fermented beverage and fermented foods. Your body may treat those as alcohol. We are not certain, and so we don't recommend eating large amounts of that. Alcohol, we don't know how much alcohol is safe to avoid fetal alcohol syndrome, and so we don't recommend alcohol in pregnancy, even alcohol-free wine, because for some reason it has a small amount of alcohol in it. Maybe it's free, you don't have to pay for it. Over 1,500 milligrams of sodium per day is too much. When you start sending me messages in the portal about Dr. Adams, I can't get my rings off, the first question I'm going to ask is, what you eat last night? And if you write back and tell me that it was Chinese food with extra soy sauce, you know what I'm going to say. So when you start flipping your foods over and realizing how much sodium is in it, you're going to be appalled that 1,500 is the limit. Any questions about food? I had someone earlier who had some specific questions about being a vegetarian. If you want to pop that back into the chat, please go ahead and do that while we move into new exercise. All right, exercise. It is just fine for you to continue your pre-pregnancy activity unless your pre-pregnancy activity was sitting around Netflix binging. It's not an actual sport or activity. All right, I'm going to pause here for a second because I have my vegetarian back asking. What foods do you recommend I eat daily to feel more full? Nuts. You can actually make like nut creams. Like if you have like a Ninja blender or something like that, spread cashew cream or something over whatever you usually like. You eat whole grains and things like that. You can spread that over there, and those things will definitely fill you up. The presentation went away for a second, but I'll just keep asking. Constantly feeling dizzy and faint. Take your vitamins and feeling. What can you do to feel stronger throughout the day? Sometimes that is dehydration, and you need more electrolytes or more water because water follows salt. If you're not getting enough salt, and I know I just said limit your sodium, but sometimes if you aren't getting enough, you can dehydrate faster. And then as I progress in first trimester, I'm vomiting more. What do you recommend? So it's actually supposed to go in the opposite direction. So that one, I recommend that you reach out to one of us because that may be something other than the pregnancy causing that. All right. Thank you for revisiting those questions with me. So second trimester, you will feel better about exercise. It's fine for you to keep doing it, but you just won't feel like it. In your first trimester, you're going to be tired and aggravated by everything. But in second trimester, you increase your blood volume by 50%, which increases your oxygen tensions and saturations, and you'll be able to do more of that aerobic exercise. So just listen to your body. If you're not the tremendous Olympiad that you were before, prior to pregnancy, don't worry, you will regain all of that. It is okay to start a new regimen. So if Netflix binging was your activity prior to pregnancy, you can start something that has you standing up and walking and moving around. Sedentary lifestyle, not moving around, leads to malpositioned babies. So my mamas who are working remotely, working from home, sitting in chairs, kind of slumped back all the time, or working on a computer where you're kind of hunched over like that, babies settle into that sunny side up position, and it's really hard to get them to decide not to be in that position at the end of labor or at the end of pregnancy. And those of you who are saying, well, I do walk a lot at work. If when you're walking, your heart rate is in the aerobic zone, then it does count as exercise. But if it's not, and we're going to talk about what the aerobic zone is in just a minute, it's just transportation. So remember that the aerobic zone, I have it spelled out here, but we're going to just do a little quick exercise. So your maximum heart rate is 220 minus your age. So if you start with the number 220, let's say you're 30 years old, subtract 30, your max heart rate is 190. So you should not be working out for extended periods of time with a heart rate above 190. 70% of that is your aerobic zone. So that's the floor of your aerobic zone. So if you are saying, hey, I walk a lot and that's my exercise. If your heart rate is between 130 and 190 sustained for 30 minutes, 3 times a week, then it is exercise. That's your goal. If it's not, like if your heart rate is still chilling in the 80s and 90s when you're walking around, let's find a different exercise. Okay. All right. Let's see. Next one I have, that made me think of pain in cows. Should I be worried of blood clots? If you have pain in both of your calves, it's not as common to have blood clots spontaneously in both calves, especially without any swelling or any redness. Most commonly, it's like magnesium or calcium deficiency. And so if you take some of those and drink more water, then the muscle cramps improve. If they don't, or if it's just one leg that you have swelling, pain, and redness, then definitely let us know so we can order an ultrasound and make sure that it's not a clot in the legs. So what exercises are safe in pregnancy? Cardio, treadmill. elliptical, running, swimming, indoor bike if you have a Peloton. My leaderboard name is Off My Meds 8, and some of my pregnant patients and I follow each other to make sure that we are exercising and staying on the right path. Other things that are okay, if you were weightlifting prior to pregnancy, you can continue lifting at that same level. You don't need to increase your resistance because your baby and your body are going to do that as the pregnancy progresses. Squats are my favorite. I mean, I just need to like put this in bold one day because if you are squatting, you are opening up that pelvis and allowing that baby to rotate and descend in the right position. You want to build up to 50 per day. If you're already squatting, like you've been squatting before pregnancy, keep going, build up to 100. If you're not an experienced squatter at 20 weeks, I want you to start giving me 5 a day. 21 weeks, you're giving me 10 a day. 22 weeks, you're giving me 15. So you're building up to 50, and it can be all throughout the day. They don't have to be 50 all at one time. You can do 25 in the morning, 25 in the evening. Other exercises that get that pelvis open, yoga and Pilates, and any experienced instructor should be able to tell you what the pregnancy modifications are for that. The question that I have here, is it okay to start running if you never ran before? If you're going to do that, I recommend one of those programs that takes you like from couch to 5K. So those are the ones that kind of start you you're basically walking the first time and you might run like 10 seconds or 20 seconds. I think Nike has an app for running it as well that trains you. It takes you to train you for a 5K. Now, I'm not saying train for a 5K, but just something that gets you started with running in very spaced out increments. The next question is, if you feel you can start with 50 right off the bat, is that okay? That is recommended. Squat away. In fact, you can start doing them right now while you're on this call. All right, things you want to stay away from though, your high intensity interval exercising after first trimester. It's not the interval, it is the intensity. So you can still do the exercises, but you just want to do the low impact version of them. After first trimester, that placenta is big enough and established that you don't want to be doing the sudden jerking movements of the high impact or high intensity rather. That can shear the placenta off the side of the wall and create bleeding. Anything that has you lying flat on your back for long periods of time, like excessive ab work, you can do side lying abs, you can do standing abs, that's fine, but just not anything that has you on your back for a long time. Hot yoga, unless you are a hot yoga instructor and are fully acclimated to that environment, you will get dizzy and you will pass out and possibly fall on your belly. So please don't do that. Scuba, because of the changes in barometric pressure, decreasing oxygen to the baby. Same thing for high altitude hiking. So you can visit your family in high altitudes, but just don't go hiking with them. 7,000 feet, 7 to 8,000 feet is really where ACOG is saying, don't get too active above those altitudes. Contact sports, please do not take up to kickboxing during this time. I've also had questions about volleyball. Anything that has a ball flying at you at high speeds, just you want to try to avoid that. And outdoor biking after 16 weeks. It has an asterisk because it's not a no, but it's just a beware. At 16 weeks is where your center of gravity starts to shift. And as you turn corners, it may be harder to recover what you thought was just a quick lean like this, and you end up tipping all the way over. All right, next we have another poll question. So y'all are exercisers. I was just wondering, like, when was I going to get all the questions? Can you prevent gestational diabetes with diet and exercise? So some of my veteran mamas have done this webinar before, and they know what my answer is going to be about this. Now that we've talked about diet and exercise, the poll is ending in 3, 2, 1, done. All right. So the question was, can you prevent it? And the answer is no. You can treat it, you can manage it with diet and exercise, but you can't prevent it. So this is the part where I said we were circling back to gestational diabetes. Here we are. We are circling back. So we screen everyone universally for gestational diabetes for one reason. Your number one risk factor for gestational diabetes is your placenta. It gives off hormones that make your insulin less effective. Your insulin has one job. It is supposed to clear your body of excess glucose, use that glucose for energy. If your placenta is telling your insulin, you don't have to do your job today, just call out sick, then you will have excess glucose circulating in your body, which is by definition diabetes, but it's gestational diabetes because it's your placenta's fault. And so if you can figure out how to do this pregnancy without a placenta, then I will not screen you for gestational diabetes. But everybody on this call has a placenta, except for you, spouse, partner, dad. And you don't. And so I won't screen you. All's fair. All right. Now, don't for my moms who say, but I never eat anything with sugar in it. You do. Like you have fruit, you have whole grains and things like that. So don't avoid your good carbs prior to the test, because you'll shock your system into, oh my gosh, we've had no fruits and no whole grains in the last several weeks, and now suddenly we have a challenge. If it is the drink itself that's bothering you, don't worry. I have options. All right, so we have definitely the Simply Pure drink, which is for sale here at Full Circle. It is soy free, it is dye free, it is gluten free, it is BVO free, it is kosher, it is vegan. Like it is offensive to almost no one. It is glucose, like glucose, just straight glucose. There are additional patient-driven options. Remember that little box that we didn't click on the website? So Fresh Test is on there, which is something that you can order. We have a link to that. Glucorganics is something that you can order as well. And these are all responsibly sourced whole organic options for glucose testing. If you are planning to use any of these things, please read that document that's on the website, because we need to know that you're planning to do that, because we cannot send you to Quest. Quest does not allow outside drinks. Also, we have instructions like don't drink it before you get there, don't open it before you get there, all those different things. And we need to write it on your lab slip that you're going to bring your outside drink. So just remember to read that whole document on the website. All right, that's my spiel. Preparing for birth. So childbirth education classes, some of you are looking to do unmedicated deliveries, and we always recommend method classes for that because, Mike Tyson says everybody's got a plan until they get punched in the face. Okay, so get your plan ahead of time. Pregnancy, labor, and delivery is like running a marathon. You don't just wake up one day and decide, I'm running 26.1 miles, or 26.2 miles. You can see I don't run marathons. But childbirth education classes, these are just a couple that are around town, people who do hypnobirthing, hypnobabies, Lamaze, Bradley method. Supporting Her is actually a class for partners. So, the best way to not get pinched and bitten during labor too, by saying the wrong things, please take a look at Supporting Her. So preparing for birth, again, the midwives will be telling you about breastfeeding classes around town. Every new parent should know CPR, so there are a couple of links here. Red Cross, obviously, you can take a class with them. And then Jax Mobile, she will actually come to your house and do a class with you. So if you already know CPR and got it, I know adults, the pound, it's different for infants, and it's not just doing the same thing with like two fingers. So definitely get a refresher on CPR if you're going to have an infant in the house. Chiropractors, if you have a chiropractor, just make sure he or she is Webster certified. That's a special pregnancy certification that goes with the appropriate changes to adjust you appropriately during pregnancy. All right, and I think we have another poll question. Who's planning on working with a doula? I know some of you I talked to during your history visit, you're like, oh, I already have my doula. And I'm like, whoa, really impressed. You're like 8 weeks pregnant. When did you tell this doula and sign this contract? All right. And then some of you are not sure what a doula is. And that is why we're going to talk about this next thing. But I'm so happy so many of you are actually going to be working with doulas. Yay. All right. Doulas are here for emotional and physical support. So they provide the support before, during, and after pregnancy. Sometimes they'll come with you to your prenatal visits. They will help you with your birth preferences. And then when you're in labor, they help you with breathing and getting into positions that make labor more comfortable, and suggesting things to help you maintain your goal of how you want your birth to happen, and help you to relax during labor too, which is really key to letting that baby out. Sometimes you're so tense that you hold the baby in. Doulas are not there to give you medical advice. That's what we are for. And you talk to Renee Hall, and your insurance company is going to pay us a lot to give you medical advice and provide the medical care. So some of you are saying, well, why do I need it? I have a doula and a nurse and a doctor and a midwife. And yes, you have a whole team working on you. It's like you're going to the Oscars. But doulas are part of the medical team that does not give medical advice. They don't prescribe medications, and they're not going to deliver your baby. You're coming to us and trusting us to provide those services for you. The best doulas are the ones who, like I said, will meet with you before, help figure out what items during labor are salient to you, so that you can make a birth plan that makes the most sense for you and your family. And then they come to your house when labor starts. They come with you to the hospital, and they don't leave your side until that baby is latched. All right. If you have questions about what doulas, because this is our 10th year and we've worked with many doulas in the community. We have lots of buddies out there. The midwives have no shortage of opinions on who their favorite doulas are, who have supported our patients over the years. Acupuncture and pregnancy massage, those are both just fine. When you come out of the bathrooms in the front, you'll see a row of business cards. The people up there have been vetted by the ones by several of our patients before, and we have relationships with them. Most places will not do massage in first trimester, not because there's anything dangerous about it, but because first trimester is that time where you're still in the higher risk for miscarriage, and they don't want something unrelated to be blamed on a massage. A lot of times, though, they will do them in second and third trimester with a note from us. We do have a standard note stating that it is fine for you to get a massage. So if you go someplace and they ask for a massage note, just send one of us a message, and our OB coordinator will send that to you as well. And acupuncture is good for nausea, it's good for sciatic pain, it's good for back pain, it's good for really everything. And then at the end, there's an acupuncture baby come out treatment. Highly recommended. Breast pumps. Many of your insurance companies do cover breast pumps. We found a company that makes it easy for you and us. So please do not go looking for your own way to get breast pumps. When you're in for your prenatal visits, a good time to do it is around 20 weeks. So after your anatomy ultrasound, just go and scan the QR code that's in the exam room and fill in the information there. They will contact your insurance company, figure out which pumps are covered, send the options to you, generate a script, send the prescription to us. We just sign it and send it off. You usually get your pump within 2 or 3 weeks after scanning the QR code. Typically, when you all go and find companies that supply them, it is a lot of back and forth, and sometimes you don't end up getting your breast pump for several months. So please use this one because we've had great success with this company. All right. Postpartum care, because yeah, one day you just like won't be pregnant. For my moms who have any blood pressure issues, we'll do a blood pressure check and see you back in the office about a week after you deliver. If you've had a belly birth, we see you about 2 weeks after you've delivered. Routine mental health screen usually occurs right after the 2 week point because baby blues are most common in the first 2 weeks after. About 80% of women will have baby blues, which is just kind of, weepiness a little bit in the front, but usually that kind of clears up by the second week. If it persists beyond 2 weeks, you may have postpartum depression or postpartum anxiety, and we want to screen and get ahead of that early. Postpartum doulas are a thing. You need physical and emotional support after you have a baby. That's what doulas are for. The Motherhood Space is also a wonderful resource here in Jacksonville. We've received a grant, not we, but Dr. Jill Garrett and through the Baptist system has received a grant to provide this kind of mommy play space that complete with childcare covered by insurance, that you go and get these sessions for psychiatric evaluations, group yoga and therapy and outdoor exercises and that sort of thing to just ease some of that postpartum depression and anxiety. And pelvic floor therapy, which is the standard of care in Europe. We do that here in the office. So when you're about 8 weeks out is when we will start you in weekly pelvic floor sessions for 8 weeks to kind of put things back where we found them because babies change more than just your life. All right. Random frequently asked questions. You can sleep on your right side, your left side, or your back. It's fine. If it freaks you out to sleep on your back, get a wedge pillow from Amazon, stick it under your hip, then you won't roll onto your back. You can help paint the nursery. Just be sure you're in a ventilated area. You can take probiotics, including things that have lactobacillus for vaginal health as well. You can dye your hair, including your eyebrows. You can do gel nails. If you're going to be in the salon with a lot of fumes, though, you may want to wear a mask to just limit your exposure to the fumes. Car travel, this is summer vacation time, so you can travel up to 37 weeks. Not because it's dangerous after 37 weeks, but just because you're full term and you don't want to have your baby in some other state because you traveled far away from us. Be sure you're drinking enough water so you can get out and stretch every couple of hours. And then skincare, your salicylic acid, your benzoyl peroxide, all those things are fine, just nothing with retinol in it. And there is an alternative, bakuchiol, Bakuchiol, to retinol without any of the harmful properties. Flight, air travel is fine for my twins up to 32 weeks, for my singletons up to 36 weeks. Just please, please, please be sure that you are wearing compression hoses, tight compression hose, doing your toe raises to exercise your calves, and staying very well hydrated while you're on the plane. Things you want to stay away from, summer crew? water slides, and roller coasters. That's all I got. All right, those are the frequently asked questions. I think the last thing that we're going to slide into is our update for COVID. And I may be frozen for you. If you're still able to see and hear me, raise your hand. Okay. All right. Fantastic. So maybe just the host is frozen. Um, Fortunately, I've done this every 2 weeks for the last 3 years. So I can just tell you for COVID, the update is ACOG moved from supporting either way in terms of vaccination to strongly suggesting that people are vaccinated. And the vaccines that are recommended are Moderna and Pfizer. We don't recommend Johnson and Johnson because it has an independent risk of blood clots. And pregnancy has an independent risk of blood clots, so you don't want to mix those two things together. If you have had your COVID vaccine and you're due for a booster now, if you're 6 months past your vaccine, your Moderna or Pfizer, you can get another one. If you're 2 months past your Johnson and Johnson, you can get another vaccine. But again, you don't want to get a Johnson and Johnson. So mixing and matching is okay. You can get a Moderna or a Pfizer if you're 2 months past your Johnson and Johnson. The ideal time for all of these, you don't have to measure them against your Tdap vaccine or your RSV, but the ideal time for all of these is around the beginning of your third trimester because that gives you enough time to create your antibodies so that when you have your baby and you're breastfeeding, you can give that passive immunity of passing the antibodies to the baby. It's not required that you have any of these vaccinations, but these are tips for people who want to have them done. If you do happen to contract COVID, the recommendation is for supportive treatment at home. There are no formal recommendations for ivermectin or for gosh, I can't remember what the other one, Zithromax, but we don't prescribe in any of those medications for it. The recommendation is for vitamin C, for vitamin D, and for zinc. If you look back at our previous presentations, you'll be able to see what the doses are on there. And then we also recommend starting a baby aspirin, the 81 milligram chewable aspirin, from the time that you contract COVID until 36 weeks. If you contract COVID after 36 weeks, do not start the baby aspirin because it will increase your bleeding risk at the time of delivery. Supportive treatment, you really only need to go to the hospital if you're having difficulty breathing or if you have a fever over 101 that you're not able to break with a normal amount of Tylenol. So that is about it. At the end, I usually have a poll question that comes up that says, what can you find on the website? And the answer is that you can find templates for your birth plan. You can find medications, safe medications in pregnancy. And you can also find ways to avoid a cesarean delivery. We also have a lovely slide that tells you that we are social and invites you to follow us on all the things, which X, formerly known as Twitter, Facebook, Instagram, all those things, because we do have that series called In Her Words, where moms tell their rock star birth stories, and everybody on here is already a rock star. And a lot of you are here because you've heard of other people's amazing birth stories. And when you have your own, we just ask that you pay it forward and tell your story for the next mama who doesn't believe that she can do it. So thank you all for hanging with me. I do appreciate you. Again, this will be available on our YouTube, but I do recommend watching the ones from before because you'll actually get to see the slides that go along with what I said just in the last couple of moments. Are there any other questions? And if not, I just want to say how much I appreciate y'all rocking with me this whole time. All right. Oops, we have a question down there. Should I be worried about calf pain? Okay, so when people ask, should I be worried? The answer is always no. If you want to bring it up at one of your visits, we can investigate it, absolutely. But worrying has never in the history of ever fixed anything. So you should not worry about it, but you should come and talk to us about it, and we will evaluate you for it and determine whether another plan needs to be made that does not include you worrying. All right. Okay, the next question is it recommended to take baby aspirin now daily? And that's individualized. So the risk factors are being over 35, having your first baby. These are small risks. The big risk is if you've had preeclampsia or gestational diabetes in a previous, excuse me, gestational hypertension in a previous pregnancy. That's a hard recommendation, yes. The softer ones are being over 35, having your first pregnancy, being African American, or having a family history of preeclampsia. If you have two of those risk factors, then it is recommended to start a baby aspirin at 12 weeks and continue it until you're 36 weeks. Other questions? Okay. All right. I think we have it again. Thank you guys so much. I appreciate you. And we will look forward to seeing you in the office very soon. Bye.